Hello everyone, thank you for watching my TED Talk. Before I get started with the TED Talk, I'm just going to go ahead and do a little bit of an introduction in case you don't know me. My name is Miranda. I graduated from The Ohio State University in 2018. I was then a nurse after that, and then now I am in physician assistant school and I will be graduating in 2021. So I'm going to start off with a little bit of a story. When I was in high school, sophomore in high school, I was training for lacrosse conditioning. I was about 15 at the time. I think this was 2012. It was in January. I was just at the gym. I was running, and after I had finished running, I went to go tan in the tanning bed. And I know what you're thinking, tanning is terrible, and I'm well aware of that now. I have a fake tan on now, so that's why I look tan. But anyways, I had gotten in the tanning bed, and this tanning bed wasn't actually a bed, it was a stand-up bed. And after a couple minutes, I started noticing that I wasn't feeling very well. I started to notice that my heart was racing really quickly. I also felt really sick to my stomach, just completely nauseous. I could not breathe. I was really short of breath, could not catch my breath. And I started to lose my vision after a couple minutes. It was tunnel vision, just like tunnel vision sounds like. It's like your vision is just closing in on yourself. And it was really scary. I didn't know what was going on, but I knew I had this overwhelming sense that I needed to sit down or bend over or something to get my head down. So I sat down, I kind of squatted, took a couple deep breaths for a couple minutes, and then I stood back up, and the feeling started happening all over again. I got really sick to my stomach, my heart was racing, I was short of breath, and I started to lose my vision again. And needless to say, I got out of the tanning bed and was really scared. Something else I noticed was this is similar to how I felt when I took showers. Not every time I took a shower, but quite frequently. I had the same exact symptoms. My heart was racing, shortness of breath, tunnel vision, just overwhelming sense of needing to sit down. So after that day, that was the worst experience I had had. I kind of decided that because that wasn't the only time this has happened, and not only does it happen to me in the shower, it has happened for quite a long time before this. I was in marching band at the time, and during band camp, yes, band camp, the oh so fun band camp, we have to stand at attention, which is just standing there not moving for a long time. And that was never fun. I always felt sick to my stomach, my heart was racing, but it was never to the extent that it had been that day. Also, church was never fun for me either, for the same exact reason, standing in one spot for a long time. Anywhere that you would be standing in one spot for a long time, I had these symptoms, but I had finally decided that something needed to be done because that was kind of eye-opening for me. I was really scared that I was going to pass out at some point. And so after that, I took it upon myself to do a little bit of reading about my symptoms. And I had come across something called Postural Orthostatic Tachycardia syndrome. And reading through these symptoms and reading through patient stories, something just clicked in my head. I knew in my gut that this is what was going on. People would state that standing in one spot for a long time made their symptoms worse. Being in the shower made their symptoms a lot worse as well. And so after that, I went to my primary care provider, which at that time was my nurse practitioner that I saw that day that I went in. I told her all of my symptoms. And at this point, being 15 years old, I had no medical education at all, so I did not feel confident, saying, oh, I have POTS, Postural Orthostatic Tachycardia Syndrome. It's also called POTS. So she said, well, maybe you're anemic, because I was a 15-year-old girl. It's really not that uncommon to be anemic if you're a young girl. So I was like, okay. And so she took my blood, and no surprise, my hemoglobin was completely normal. But unfortunately, no other investigation was done. She just assumed that since my hemoglobin was normal, I wasn't anemic, and there was actually nothing wrong with me. So I thought that, the nurse practitioner didn't mention POTS. There's no way that it's POTS. She would have, caught it if it was. So I just assumed that nothing was wrong with me for years. I went through nursing school, the rest of high school and nursing school, feeling like this quite often. I would go out with my friends, standing around in crowded areas at Ohio State, and I would frequently not feel good for the same reasons that I just explained. And being in nursing school, you're doing procedures, or you're watching procedures, or you're watching surgeries, and not just nursing school, but any other kind of, medically related school. You're doing a lot of standing around and watching, and you can't move some of the times, or else the patient gets hurt. So it was really scary. Sometimes I would feel these symptoms come on, and I would just be terrified that I was going to pass out. But thank goodness I never did. And just to illustrate how I was feeling, or kind of give you a sense of what was going on with me, I will insert a video of what my heart rate does when I stand up. Just imagine going years without knowing why your heart rate goes up that high every time you stand up. Sorry. So obviously those videos just don't do it justice, but I know there's people that say your heart rate goes up when you stand up. What's the big deal? And what I say to them is, imagine if you felt like you were doing cardio every single time you stood up. Every time you're in the shower, every time you're at church, every time you're standing around talking to your friends. But anyways, flash forward a couple years to PA school. I was essentially sitting down all day, every day. I would work out 3 to 4 times a week. So essentially standing up for less than an hour a day kind of made my body less used to standing. And so my symptoms were getting worse. And something else that I had realized was, I'm going to clinical next year. I'm going to be doing a lot more standing around than I ever did in nursing school. And I'm going to be on a surgery rotation, literally not moving for probably 6 to 8 or longer hours at a time. If I have POTS like I thought I did when I was 15, I have to get it diagnosed and I have to get it treated. So I got a new primary care provider. I went to him and I explained my symptoms, so he referred me to a cardiologist. When I went to go see the cardiologist, he initially blamed my symptoms on my supraventricular tachycardia, and that is an arrhythmia that I had previously had treated and ablated a couple years prior. But finally, I was like, since my symptoms are when I stand up and etc., I was like, I think it's POTS. And he was like, okay, I guess maybe. And so he went to go talk to the electrophysiologist, and the electrophysiologist recommended that I get a tilt table test. What a tilt table test is you essentially get strapped down to this table and you're laying completely flat for about 30 minutes. And then after that 30 minutes is up, they tilt you up to about a 70-degree angle. And at that time, they're monitoring your heart rhythm, and they are monitoring your blood pressure, your heart rate, and your symptoms. So when I had my tilt table test done, I was laying down for about 30 to 45 minutes, and then they tilted me up, and immediately I started getting extremely bad symptoms. My heart rate shot up to 190, again, almost immediately, and it hung around the 180s. And I'm going to insert a picture here just to kind of show you what was going on during the tilt table test. And so I only lasted, I think, a minute or two, and the electrophysiologist came in and said, we need to bring her back down. I was crying because I was so miserable. And he said, you have postural orthostatic tachycardia syndrome. No surprise there. Sorry. It just felt so validating when I got that diagnosis, but also it made me so angry because I had been feeling like crap for years and I never got treated for it. And not only that, I found out that I have inappropriate sinus tachycardia. So my resting heart rate is really high as well. So anyways, we got me started on metoprolol every single day, and that medicine did really well for me. But eventually, for things that I'm not going to go into now, I'm now on ivabradine and verapamil. So luckily, my heart rate is well under control now, and I barely ever have symptoms. So all I can say is thank God for that electrophysiologist. Really appreciate everything that he did. So after I got diagnosed with POTS, I was doing some more reading, and I found that POTS is extremely common in a syndrome called Ehlers-Danlos Syndrome. And I'm not going to go into too much depth about this because it's not the point of this video, but what Ehlers-Danlos Syndrome, or EDS, is, it's a genetic connective tissue disorder, and it results in, or it is a result of, mutations in genes that either code for collagen or other proteins that have to do with collagen synthesis. So I felt that I really needed to bring this up with my cardiologist because I felt that this syndrome really aligned with a lot of the other things that went on with me throughout my childhood and young adulthood. And again, I'm not going to go into too much detail about that right now, but when I went up for my follow-up visit with my cardiologist after my tilt table test, this was even harder to bring up than the POTS the previous time, but thanks to my professor at my PA school, she kind of helped me work up the confidence to bring this up to my doctor. And I did. And thank goodness he listened to me because he immediately gave me a referral to genetics at Children's. And there I was diagnosed with Ehlers-Danlos Syndrome. And this is something that I've had my whole life. I haven't had symptoms of it my whole life, but I've had symptoms of it for a very long time. And so this reinforces the fact that providers really need to listen to their patients. And this brings me into my overarching message here. Whether you're a patient or a provider, providers, please, I'm begging you, listen to your patients. If I would have had a provider 8 years ago when I was 15 years old that would have listened to my symptoms and taken me seriously, I would have gotten diagnosed with POTS 8 years ago. I would have been treated. I would not have been miserable throughout the rest of high school and college, and I would have honestly had a better quality of life. No matter if your patient has an anxiety diagnosis, or you think that they're malingering, or if you think that they are overthinking, or if you think that they're being dramatic, I want you to take a moment, and just consider the differentials. Is what this patient is bringing up, is it even plausible? And if it is, I need to give it a second look, because what if I'm missing something because I'm assuming that this patient is just anxious or just being dramatic? If you listen to your patients, I can assure you, coming from a patient's point of view that have had multiple experiences with patient or providers not listening to me, it can make a huge difference on not only your rapport, but the patient's quality of life after that. They're going to be a lot more trusting with providers and you. They're going to really trust you. And not only providers, but patients. If you're a patient and you're watching this, I really encourage you to make sure that your provider is listening to you. Make sure that they are taking your symptoms seriously. And if they're not, tell them what you think is going on. If you have done a lot of reading about your symptoms, tell them what you think is going on. And by no means am I condoning self-diagnosing at all, even if you are a physician assistant, a nurse practitioner, a doctor, a nurse, another medical provider, even if you aren't in medical at all, self-diagnosing is never okay. If you think something is going on, you have to go to a provider and get that proper workup for it. So I hope this TED Talk gave you something to think about the next time that you go into work or go into the doctor's office. Thank you for listening. Bye.